Hello and welcome to the NP-POW, the podcast where nurse practitioners come to learn, grow, and lead. I'm Dr. Julia Rogers, your host and fellow nurse practitioner, bringing you those powerful POWs or pearls of wisdom that can transform your practice and elevate our profession. Today's episode is one that we've all been looking forward to because it really answers a pertinent question that sits at the crossroads of every NP's career. Where do I go from here? Whether you do a DNP, a PhD, or a dual degree. These aren't just letters after your name. They actually represent very distinct visions for how you want to show up for this profession, for your patients, as well as the future of healthcare. And yet for many nurses, standing at that fork in the road, the path forward is anything but clear. And today, we're changing that. We are joined by two exceptional nurses who have lived these decisions, navigated these pathways, and emerged as voices in our profession. And everyone needs to hear this. So today we have with us Dr. Tracie Kirkland and Cheryl Thaxton. Welcome to the NP-POW.
Greetings. Thank you for having us. My name is Dr. Tracie Kirkland. I'm an Associate Dean for Transformational Practice and Partnerships at the University of Nebraska Medical Center. I am also an adult and pediatric nurse practitioner, and I am one of the few that hold a DNP-PhD. So I consider myself a DNP-PhD prepared scholar. Thank you again for having us.
You're welcome. And Cheryl, what about you? What is a little bit about your background?
Thank you so much. I'm honored. And today I'm happy to be here with Dr. Kirkland to talk more about our background. I have been a nurse for 34 years. I'm currently serving as the Associate Dean and Chair of Graduate Studies for a program in Fort Worth, Texas, and super excited about just the context and opportunity to talk about being a student yet again. So I'm also a pediatric nurse practitioner, similar to Dr. Kirkland, and I'm a family nurse practitioner. My background is in palliative and hospice nursing. So I have done the gamut of education, master's degree, postmaster's, DNP, and now I'm in the final stages of pursuing a PhD with the wonderful coaching of Dr. Kirkland.
Wonderful. Well, welcome again. I know that this podcast is going to align with a journal article that you are going to have published. So do you want to talk a little bit about that article and what it's going to tell the rest of the readers who aren't able to listen to the podcast?
Well, thank you, Dr. Rogers, for that question. And basically, I was inspired because seeing so many of my colleagues that are now matriculating in the DNP-PhD program, and there are a few of us that are, again, dually prepared. And that was the impetus for examining what's this transformative shift that's occurring. We don't have data that supports what we are doing, why we're doing it. We just know that it's something that's being done. So a group of us, a collaborative group of us, came together there, and it was intentional. 3 of us are dually prepared, and there are 3 that contributed to the article that are currently matriculating in the DNP-PhD program. So this article, it's not new because many individuals will read the article and say, this is nothing new. We have articles dating back to 2016 that examined the DNP, the PhD. However, we're seeing an emergence of individuals or scholars or academicians that are in pursuit of this. So our goal is basically to examine what's happening, what's the shift, how are we contributing to science, how are we translating, how are we synthesizing, and just a brief introduction to this emergent role. So, Dr. Thaxton, would you like to contribute and share your thoughts with regards to this article and what your feel was when I asked you to participate?
Sure. Thank you, Dr. Kirkland. I was assigned to speak from that student lens, and a lot of what I poured into that paper added to the student lens and also the DNP lens. But I would say as a student, I thought about how expansive and demanding the curriculum and rigor has been for me as a student. It's really like standing in 2 worlds at once, right? Where I'm no longer satisfied with just applying this evidence, but I also feel compelled to question, to be curious and to generate and refine the areas where I started out as a DNP. So there was this constant tension or thoughts looking at practice and then looking at theory, but also a deep sense of purpose, knowing that I'm gaining the tools not only to improve systems, but to really fundamentally reshape how knowledge is created and utilized in healthcare. So I'm really super excited and glad to be part of this process.
Wonderful. What do you think is the most important factors that nurse practitioners should weigh when they're deciding whether to go forward with a DNP, a PhD, or a dual degree? And then how does one actually decide if that one degree is truly better for them than the others?
Let's ask Dr. Thaxton to start with that. Since she's currently matriculating, I think that providing that lens in real time really will shape the answer, the response here.
Great. Thank you. I love that question. So here's my perspective. Nurse practitioners and nurses should weigh on their own long-term goals, right? So they should be intentional about where they see themselves in their own trajectory. So whether they are driven to improve systems or look at patient outcomes through practice or really generate new knowledge and lead research, neither degree is better. They're both very good degrees. The right choice to me really depends on whether they want to apply evidence or create it. That's my perspective.
And for me, I think it's an internal personal decision. For me, I pursued my DNP. I completed it in 2013. And that was during the time where there was a push that the terminal degree should occur by 2015. So that was my impetus for doing the DNP. But personally, I always wanted to pursue or to obtain my PhD. I had a mentor back at Virginia Commonwealth University, Dr. Cindy Monroe, who is a renowned nurse scientist, who asked me to encouraged me to pursue my PhD during that time. And that was the early 90s. But life was happening. And as a result of having a young family, it was just not the time. And because of the commitment, when we think of a PhD, the time commitment is a little bit longer than that of the DNP. So I think what we're seeing in essence now, as we're seeing increased enrollment in DNP programs, that time factor is very important for many individuals. But for me personally, it was a desire to always complete my PhD. When an individual is deciding a DNP versus a PhD, it's like Dr. Thaxton said, it's an internal decision. Are you aiming to synthesize, apply evidence, or is there a level of curiosity that's sparking the desire to generate new knowledge? So that's my thought with regards to that question. And thank you. That's a very good question.
Well, and I do think maybe today my personal decision is DNP, but in 5 or 10 years, maybe my decision would be PhD. So I agree with you that it can change or fluctuate.
Absolutely. And it's the maturational process. As we're cultivating, curating growth in our professional career journey, that trajectory can change at any time. Many of us who work with coaches, who are in leadership roles, we aim to do different things. And as a part of that trajectory, we sometimes self-reflect and determine what's needed to help us leap from point A to point B or pivot from point A to point B.
I think that you guys both alluded to this a little bit, but in practice, how much does the DNP clinical versus the more PhD research distinction actually play out in day-to-day roles?
I think it depends on where you're working. Are you working in an academic setting? Are you working in a hospital setting, an acute care setting? Because we're seeing the roles in both settings. You're seeing the DNP prepared scholar, academician that's teaching, that's also practicing. You're also seeing the PhD prepared scholar that's teaching, that's practicing, but also working within acute care settings and generating clinical research. They're also doing bench research. So again, I think the settings aren't really a delineating factor anymore because we're in both sectors. We're generating policies, we're creating guidelines, we're looking at QI projects. The PhD scholar, again, may be a PhD prepared scholar that's also a nurse practitioner. So there's an intersection of both roles. But what are your thoughts, Dr. Thaxton?
I would definitely concur with your statements, Dr. Kirkland. And there's a distinction a little bit that's evident in the daily roles. I have some DNP colleagues that lead academic centers, they lead hospitals, and I have some PhD colleagues that also lead academic centers. So with the DNP prepared NPs, they often lead this quality improvement piece, right? And the clinical innovation and system change. And then I have, the lens of the PhD prepared NPs or leaders focus on research, focus on data analysis and theory development. So there is a crossover per se of the roles that is really dynamic and wonderful to see. In real world settings, these roles do overlap quite a bit. And like I said, I have colleagues that sit in several seats and have a PhD in DNP. And I would say, in all honesty, I was one of those students that said, after my DNP, I'm done with school. I can't do anymore. And it was really the encouragement of colleagues like Dr. Kirkland and others that said, no, there's some more I see in you that really, you can do more. And so they really pushed me to go beyond the boundaries. And I'm excited about that. So I hope that answers your question.
It does. And really what I'm getting from that is both degrees, or even the dual degree included. So all three degrees actually give APRNs the most leverage to drive change, whether it be policy, patient outcomes, or clinical practice. They're just changing it in different ways.
Absolutely. And we would be remiss if we did not include our DNP, the executive DNP programs. And for example, I would be remiss if I didn't share. I happen to be in an organization where my dean is DNP prepared, but she's the leader. She's the dean of an R1 university. So that in and of itself, it's something new and on the horizon. Years ago, you would think one would associate that role with someone that's PhD prepared. They have a body of research that they have an expansive contribution in terms of receiving NIH funding. But again, this is transformative, and I think that is why it sparked the interest of creating this article, because of such transformative changes that are occurring. And not just my dean, but there are other DNP prepared leaders that are actually at the helm of universities as well.
Speaking specifically about the dual degree, having a DNP and PhD, how does that dual preparation really uniquely position nurses in order to bridge that research to practice gap and then lead that transformative change that is really not just a single terminal degree pushing it?
I would say that innovation piece is important right now as a student, being intentional about looking at innovation. The way I shaped practice as a palliative and hospice nurse practitioner now, I'm looking at it through a different lens. So it looks like looking at design models to really shorten the research to practice gaps. Right now, simulation is a big piece of what's new in the space of that DNP to PhD bridge, how to utilize it, how to upskill the things that we were doing, leveraging technologies and data analytics, and really trying to transform what we're doing in education and care delivery. So as a student, I would say there's a different discovery phase I'm having right now that's exciting, intriguing, and I'm just constantly curious about what it's the next paper going to look like. And I'm in my chapters now, refining them, and I'm enjoying that. So it really counts as scholarship, really brings value. And I think this is a really good return on investment for me as a student. And I could see that being poured into other students that are in my cohort.
Well, and both of you are great examples of how nurses are lifelong learners. Your degree really isn't the end of where you're going to end up because you keep learning even after that.
Absolutely. And to add to what Dr. Thaxton said, I think the nursing research, the actual process itself, the methodology, and being able to analyze your data, to work with statisticians, to really be immersed in collecting data and then to be able to apply it, I think for me was very important. My research was related to social support, loneliness, and the intersection of food insecurity in Black women. And for me, as a DNP prepared scholar, I understood how to apply, to synthesize the information, but having that PhD completed format or rigor or mentors assisting me allowed me to learn how to collect the data, to be able to go through the IRB process, to be able to create my study protocols, and to really be able to sit down and to analyze information. And for my particular study, there was no statistical significance initially, and I was really bummed out. But in doing additional research, understanding that when there is no significance or statistical significance, that in and of itself still is a contribution to science. So for me, it was a learning process, and I enjoy being that lifelong learner. And the key is to generate pipelines of individuals so they too can be interested and become lifelong learners.
Agreed. What type of innovative roles are DNPs showing, or PhD, or that dual degree, and how are they pioneering things in academia, in leadership, in interpersonal research, health equity, as you mentioned, Dr. Kirkland? And then how does maybe that dual degree preparation disrupt what we know as those traditional silos that we put each other in?
That's a really good question, and to be continued, because it's forever evolving, but we're seeing a lot of academic leadership positions that are involving strategic planning. We're seeing practice partnerships. Again, they're not new, but we're seeing it continue to evolve. So I think that we don't quite have the full answer to that. And that's where the next phase of this group in collecting data to see what innovative practices are we doing and are contributing in academia, in practice, in policy, on boards. I think that that's the next step. So we'll have to have a part 2 of this podcast.
I think you just gave a lot of people something to research.
Yes. Dr. Thaxton, do you have any thoughts with regards to that question?
I agree. I see the expansion of NP roles and leadership roles and executive nursing roles. Definitely. One thing I wanted to mention is academic institutions see that PhD preparation for like tenure track roles, research intensive, and so DNP space for academics look at clinical faculty and other leadership positions. However, there is a crossover now where DNPs at some institutions can receive tenure. I'm one of the few tenured DNPs right now, and it's been exciting because I had mentors. And I will say, Dr. Kirkland is aware, mentorship's been a big part of who I am, my professional identity. Not only am I mentoring people, but I'm the product of good mentoring. I've had wonderful mentors. But having said that, I would say that the process of becoming a tenured DNP was through mentorship and being coached on scholarly writing, pulling data, looking at my patient caseload, trying to pull out a good case study to teach other students. So really trying to, pour into others and making sure that we're sharing knowledge and information. And so we're seeing a different lens in terms of innovative ways to approach both roles of PhD and DNP, and now the dual impact of the scholarship and that system impact of being a dual prepared NP. It's really powerful. And it's not just a trend. It's really something that everyone is embracing as necessity, that it really has so many benefits and return on investment that a lot of people are looking into that.
Very well put. And congratulations on your tenure.
Thank you.
Yes. That's a big deal for those listening, to be a DNP prepared scholar and to have tenureship. And that's one of the debacles that we have nationally is some universities allow it, others don't. So again, to be continued, because I think a lot of what the questions that you're asking, the answers are yet to be determined. We're paving the way. And as we're able to pave the way, collect data, and to be able to publish and disseminate, I think that it'll open up additional doors.
I agree with you. I know both of you work in academic settings as well as practicing as nurse practitioners, but how do academic centers or institutions and healthcare systems, as well as maybe just clinical organizations, how do they differentiate between a DNP and a PhD prepared nurse when hiring them, whether it be for faculty or a leadership role or as a clinician?
My response to that is that it's not a defined process for any organization, any university. And then if you add in geographically, I just think that there are just so many differences, which really lends to the fact that nursing is so diverse in what we bring to the table, our abilities, our capabilities, and even in the institutions whereby we work. So I don't think that there is a delineated response to that. And that's in my lens. Dr. Thaxton?
I would agree. It's really specific to the academic setting. The dual degree preparation, though, looking at another aspect of it, does bridge a longstanding gap. And so I'm excited because, years ago when I started my DNP, it was just still pretty separate. And I see how it's bridging together in that we call cross-pollination of that DNP and PhD roles are coming together better. For example, as a DNP, I was able to sit in on a PhD as part of a committee. I had a PhD chair reach out to me and say, hey, this is in your clinical expertise, palliative care, and we need someone with that sharp lens. Would you mind sitting on this committee? So that PhD chair approached me. And so years ago, you may not have seen that, but this is just saying that things are changing. And notably, I think when we were doing our research, Dr. Kirkland, I read somewhere that it said it can take 17 or almost 20 years in healthcare for something to be translated from practice into research. There was such a delay and gap. And now those things are happening much faster through implementation science and systems leadership, bridging with research much earlier on. And so I think that dynamic is really something to consider. But again, going back to the first part of your question, it's so specific to each institution that it's hard to draw the line and say exactly. So I agree with what Dr. Kirkland stated.
I want to interject and say that most recently, if you look in the literature, you will see DNP-PhD collaboration. That's what's on the horizon. You see the most recent articles, and I think as someone reviewed our manuscript, they were like, this is nothing new. It's not anything new. We are encouraging more collaborative work in terms of DNP scholarly projects. We are even coming together in terms of being on committees, but you're really seeing how we're coming together to do this work in a landscape where there's a plethora. There's much to do in addressing health inequities in terms of generating pipeline, and especially the number of students who are matriculating in PhD programs. We've seen a decrease within the past few years. So is this potentially an answer in increasing enrollment by having more DNP prepared scholars matriculate? And we don't know the answer to that. And I think that's the transformation that's occurring because we don't have these answers, and that we're working together to try to generate this data for real-time dissemination.
I mentioned earlier how we can put each other in different silos. You're in this DNP, you're in this PhD. So what do you say to those that come to you and kind of say that the DNP curriculum really isn't adequate enough to prepare their graduates for any type of research, and that only a PhD can close that gap?
My initial thought is what Dr. Thaxton alluded to earlier. It's mentoring. So I would not want to take away from the fact that a DNP prepared scholar has not been prepared to generate research or to actually be involved in research, because with the right mentoring, and again, it refers back to that previous question, it depends where you've matriculated, geographically, what the conceptual thoughts are in terms of preparing that DNP versus the PhD. We know that the PhD program is rich in research. That's what it's all about, generating new ideas and creating that query, creating or involving that curiosity or sparking curiosity. But that DNP prepared scholar, if they have the PhD committee chair, or if they are in a R1 university where it's really emphasized, we're seeing DNP scholars, and especially at Duke University, you have Dr. Reagan Johnson, who is very much involved in research in terms of her barbershop, but she's working alongside PhD prepared scholars. So it's happening.
I would definitely agree that it's happening. It goes back to something you mentioned was the pipeline, right? That part of that mentorship and the pipeline of the future nurses that we're trying to bring into the field and making sure we're sustaining the field. So it has been happening. I think it's been encouraged through mentorship, through the pipeline lens, through competency-based education, those types of things that really call for collaboration, call for interprofessional collaboration. It's expanding because it has to meet the needs of our patient population. And that's the ultimate focus, right? Our patients in the community, all the things we're doing, the research, the collaboration, the quality improvement, all of the clinical and research expertise builds into helping society as a whole.
Very good. Very well put. How does the return on investment actually look like for each degree pathway, especially when you're factoring things like not just tuition, but time away from the practice and possibly even potential salary differences?
For me, I think individually, how are we measuring return on investment individually? I mean, are we measuring it from a monetary perspective? Is it a sense of reward and accomplishment? And for me, it's both. And I can't say that we have real data to support the return on investment in terms of cost, benefits, and salaries, because the roles are just too new and we don't have the data. And that's the missing link. And that is where collectively, if this group can come together and do do a mixed method study, examining qualitatively, why did we choose this route? From a quantitative perspective, did it change our salaries? Did it change the costs that we paid into the programs, basically in retrospect to the return that we're getting on health outcomes? So it's how are we defining return on investment? That's my thought.
Love that. Love that. And that mixed method study was what I was thinking about. So like we're vibing right now. There's so much that we could do and expand even beyond, the podcast and the paper and just with our colleagues in the field about this topic. I think it's something that's going to grow. And like Dr. Kirkland said, we're looking at the kind of study that looks into leadership roles that are acquired after having a dual degree, right? Salary advancements, clinical practice versus research. What does the trajectory really look like? I think we're in the space of the doing part, and some of the trajectory we won't know for a couple years to come. There's rewards tied to it in terms of research funding, academic advancement, and then overall long-term influence in our roles. So those things are yet to be seen, and I think that Dr. Kirkland is spot on with her reflection.
How would one that has a DNP and let's say they want to pursue a PhD, how do they go about finding the right mentor to guide them along during that PhD program? What did you do, Dr. Thaxton?
Great question. I had some mentors in place. I actually did talk a couple times with Dr. Kirkland about her program, her trajectory, the curriculum and the rigor. I chose a wonderful program, Indiana University of Pennsylvania. They took a lot of my DNP credits and acknowledged some of those courses and the rigor there. So I really chose a program where I knew I would flourish. The faculty there are wonderful, very supportive, and they have that one-on-one intentional connection that I really needed as a PhD scholar, trying to balance working. So I would say talk to someone right now that's living in that space of being a student or have graduated and have their DNP to PhD completed, and just ask some questions and think about what I said in the beginning. Where are your individual goals in terms of your professional identity, number one, but where do you see yourself in 3, 5, 10 years? And then match that with your conversation with your mentor and then with your long-term goals. tie them together and look at it as an individual where you want to be. And there's no limit. The sky's the limit.
How did you, Dr. Kirkland, get involved in mentoring others to come along to the PhD programs?
Too much is given, much is expected. That's been my philosophy all of my life. And I think it's important to share, to give back to others a different perspective, really the first phase of the nursing process, to assess what are your thoughts, what are your goals, where do you desire to be in 3 years, 5 years, 10 years, so to create a timeline. And for me, it's just an innate ability to just mentor and to share my story. And when I share my story, there are many individuals who want to learn more. They ask for additional information, and it's almost an innate process. And for me, I matriculated at Texas Women's University. And going back to your question, how do you select the program? Sometimes you'll hear individuals, especially who are matriculating in PhD programs, they select programs based on their areas of interest and then prepared academicians at the university with a body of work, funded work. That's almost like the ideal or the trend that occurred for years and years. I selected a program because I wanted it to be hybrid. I wanted to have the support that I felt that I needed to be successful, and the flexibility to be able to work and to continue to study as well. So those were my rationales in selecting my particular program.
Following along that line, what is one piece of advice that you would give to an APRN that's really just sitting on the fence about which doctoral path to take? And what is one question that they should really ask themselves before applying?
I'm going to start with the second question first. What are your desires? What are your short, your long-term desires? Are you able to fulfill those desires and or commitments in your current role, with your current education, with your current support system? If the answer is maybe, maybe not, or no, then that's a great way to think about all the other pathways, whether it's a dual certification, because we're seeing more people go back now for Psych and P, because of the supply and demand for mental health, and or is it a desire to have a terminal degree? And what we're encouraging in most organizations, and especially the National Organization of Nurse Practitioner Faculties, we're encouraging that terminal degree. We have groups of individuals or researchers who are collecting data that show, that demonstrate when you have a terminal degree, health outcomes are better. So that's my response to that question.
I love that. I think Dr. Kirkland really answered that entire question so well. The only thing I would add to that is maybe choosing this program or degree that aligns with the type of sustainable impact you want to have in your everyday work, but to society. Not just really a title that you want to hold, but choose and look at your impact. Go back and look at your entire CV. What has been your 1 or 2 areas that you've really been honing in on to grow and to pour into others? And so looking at impact and sustainability, tie that into the programs. Look at the programs that exist and try to bridge that with some input from someone else that's done this and taken this path. Get some advice before you actually enroll. I think those, in addition to the wonderful things that Dr. Kirkland stated.
And Dr. Rogers, I'm at the tail end of my career, but I think I've created a CV that over the next 10 years, I can decide, I can choose if I want to go back and do research. I can decide if I want to go back and be a clinical administrator and assist with systems and link clinical partners to community, to academia. There are just so many choices that I now have control of by having both degrees. So for me, it's a win-win, whether the cost that I expended to pay for both degrees versus my impact, as Dr. Thaxton stated, there is just no comparison. And I will share that I was fortunate. I had the faculty loan program. for my DNP. That's something that's now withering away. I also, as I matriculated at Texas Women's University, I was very proud to be the recipient of scholarships. So for me, the financial investment and what impact that I can bring to society, there is no comparison.
Wonderful. Now, this is my favorite part of the show each time. So can each of you share a pearl of wisdom or a POW to our audience? One big takeaway that you want them to walk away with today.
Dr. Thaxton.
I would say look into your legacy in nursing, the things you've done over your amazing career as an individual. Look deep into that. Be intentional with your selection of a program and talk to others. Seek advice and really look at your impact in terms of your legacy. What impact on the world? How are we going to utilize our amazing profession to really keep changing the world and cross-pollinating and working with our interprofessional partners to make things better?
Mm-hmm. Very good.
And I will add to that, because working with the Leadership Mentorship Program with NOF, we talk a lot about legacy map, career development. I think my pearl would be, how do we create the next generation, the next pipeline of nurses? And how can we instill upon them the different pathways and the uniqueness and the diversity that we can bring? And I will conclude by saying we're working in Omaha with a group of middle school students in Houston using our IXL, our technology. We're interviewing nurses to talk about the various roles that we're doing. We're going to showcase our IXL building. And again, this will help bring along our next generation of nurses. So my pearl is, the world is yours. Seek out windows of opportunities, look at your mentors, and collectively determine what is your impact on society, in education, in practice, and in service.
I love that, Dr. Kirkland. Thank you for that. Thank you both for being here today. I really have learned so much. So I appreciate both of you taking your time and sharing your knowledge with everyone today.
I would like to say thank you, Dr. Rogers. Thank you to Kimberly Yoon and to all of those who allowed this to come to fruition. It was a seed that was planted. We've watered it, nurtured it, and continue to watch it bloom. Thank you.
Thank you, Dr. Rogers. It's been an honor and super reflective, and to be here in the presence of a wonderful mentor, Dr. Kirkland. Thank you for inviting me, and thank you, Kimberly.
I feel like today was really just a powerful conversation. So I really appreciate your honesty, your depth, and just overall passion for the nursing profession. And I know that the insights that you gave all of us today are going to go far beyond the degree and the credentials, because at the heart of this conversation is something much bigger. And it's the future of nursing and who is going to lead it. To our viewers and listeners, whether you are practicing NP or weighing your next step for a DNP or PhD, or maybe you're already doing the work or in a dual degree, you are still a trailblazer pushing the boundaries of nursing leadership and what that looks like. The doctoral path is not a one-size-fits-all, if we learned anything today, and that's not really a weakness. It's our strength, because our profession needs clinicians who go deep into research, deep into practice, and it needs everyone generating new knowledge. So we need visionaries who can do both. And what it needs most are nurses who just are intentional about choosing their path with clarity, purpose, and courage to just own it. And if you found today's episode valuable, then please log in and follow the Nurse Practitioner Journal's NP-POW video and podcast, and share it with your colleagues, your students, and your networks. Until then, this is Julia Rogers reminding you to practice with passion, lead with purpose, and find joy in the journey. See you soon.
For more great content from the Nurse Practitioner, be sure to visit us online at tnpj.com for the latest NCPD articles, columns, and much more. Please leave us a 5-star review on iTunes and Spotify, as it helps with the podcast's visibility and helps us to keep bringing you this great content. Also, don't forget to follow us on Facebook, Instagram, and LinkedIn at The Nurse Practitioner Journal, and on X at TNPJ_journal. This podcast does not constitute medical advice and should not be taken as such, and does not replace professional judgment or advice. The ideas and viewpoints expressed on this podcast do not reflect the official position of the speakers, authors, affiliated organizations, the Nurse Practitioner Journal, or Wolters Kluwer. Thanks for listening.